Eric. Today your blood pressure is normal, your lower lymph function is restored good, and no neurological symptoms. So you are medically healthy. I am planning to discharge you today.
Okay, well, if you say so, I'm okay with it.
Doctor, sorry to interrupt, but before we proceed with discharge, I need to raise concern.
Yes, Nestle, what's your concern?
So, Mr. Eric has barely eaten for 2 days. Yesterday, he only ate 2 spoons of porridge, and today he refused breakfast again, and he looked very weak when I tried to sit up to him.
It is common for patients to lose appetite. Maybe he preferred home food more than the hospital food. And also, his condition are improving.
I understand, doctor, but this is not has been 1 year. It's been 2 days, and we also cough every day.
Coughing happen occasionally.
Yes, but in post-stroke patient, coughing can mean swallowing difficulty.
Usually, we can delay the discharge because of your appetite. The bed are limited.
I wanted to eat, but it's very hard for me to swallow, and I feel very tired as well.
But doctor, I strongly recommend we involve dietitian and speech language therapists before you discharge.
Alright, we will further examine the patient, but we need to be additional.
So, good morning, Eric. I am the dietitian. So, I heard you have not been eating well.
I'll try, but I often get full very quickly, and sometimes the food feel like it's stuck in my throat.
So, based on this intake chart, you have taken less than half of your meal for 2 days. And for a 70-year-old recovering from stroke, this is not safe. And you need energy and protein to regain the strength.
Can this be managed at home with advice?
Not yet, doctor. But if he goes now without a nutrition plan, I think his weakness may worsen. And poor nutrition can delay his recovery and increase the fall risk.
You already look weaker than yesterday, doctor.
Well, I recommend soft high protein meals and oral nutritional supplements. But also, I need the speech language therapist assessment first because his nutrition is useless if the food is not safe for him now.
Fine, we will wait for the swallowing assessment.
Good morning, Mr. Eric. I am Miss Alia, the speech language therapist. I will assess the swallowing. So, Mr. Eric, please take a seat. Okay.
Yeah, sure.
Are you okay, Mr. Eric?
I'm okay, just coughing.
This is why we need to be careful. He is showing a sign of mind misfire.
So, are you saying discharging him is unsafe?
If he goes home today without swallowing precaution, yes, there is a risk. He may experience fluid or food which may lead to pneumonia.
Alright, this is becoming more and more complicated.
Hi doctor, I have reviewed Mr. Eric medication chart. He's on medicine after stroke. Some may contribute to nausea, dizziness, and reduce appetite during medication.
He did complain of nausea after morning medication yesterday.
That might be one of the reasons because it's not eating. So the timing of medication may also be affecting his meals.
But this medication is important for the stroke prevention.
Yeah, I agree, doctor, but I'm not asking to stop the essential treatment, but I'm just suggesting the medication optimization.
So, discharge today is not possible.
Yeah, not until the medication issues are reviewed.
Dr. Nat, I need to report something. Mr. Rick, resting heart rate is 108 beats per minute.
But his blood pressure earlier was acceptable.
Yes, but the increased heart rate may be a sign of dehydration, especially with his poor oral intake. His fluid intake has also been poor, doctor. His latest blood results also show mildly raised urea and also slightly high sodium, which support the dehydration, and his albumin is also slightly low as well.
That matches the food intake findings.
Hey, Miss Amani, this is giving us the concrete evidence to not discouraging the patient.
Exactly. Laboratory findings should not be viewed alone. In this case, they will support the clinical observation from the team.
Kids, we have to decide now. Mr. Eric should be discharged today, but multiple concerns have arisen. So, each of you guys have to arise your concern so we can continue to discuss it.
From the nursing perspective, I do not support discharge today since he is weak and eating poorly and also he's been coughing also.
Well, from a nutrition's perspective, I recommend delaying discharge.
From Soleil perspective, discharge him is unsafe until his dysphagia is managed.
For pharmacy perspective, medication side effects and timing need to review before discharge.
From lab perspective, the blood test shows dehydration and also poor nutritional status.
I understand all of your concern, but the ward is full, so we need to be anxious.
Doctor, with respect, this is not a small concern anymore. They are all connected.
Yes, because poor intake explains the weakness.
Yes, and dysphagia explain why he is coughing during meals.
Medication side effects will explain the nausea and reduces constipation.
Yes, and the lab report also strongly suggests dehydration.
If we discharge him now and he goes home and he aspirates and become dehydrated at home, the discharge has failed.
Alright, I understand all of your concern. I am too focusing on the stroke improvement, but not the overall health of the patient. So does everyone agree that the patient cannot be discharged today?
Yes.
So we will postpone your discharge for the multidisciplinary track. Mr. Eric, we will not discharge you today. Your stroke recovery is improving, but your overall health is still in our concern. So we will go further with your care.
Thank you for not rushing me.
So I will monitor his food and fluid intake and also his vital signs, and I will also check for coughing during meals.
And I will prescribe a soft high protein diet and oral nutritional supplements.
And I will provide swallowing therapy and teach him safe feeding techniques.
I will review his possible side effect and also time.
I will process repeat lab investigation and I will report any abnormal findings lah.
I will review his hydration status and we assess him for the medical care.
This is a safer plan.
Yes, and this is why interprofessional work is important.
So Mr. Eric has been eating more than half of his meal, and he's also been drinking better.
Yes, his nutritional intake has improved with a modified high protein diet.
Yes, and now he is swallowing with precautions too.
His medication timing has been adjusted and nausea has been reduced.
And his repeat blood results also show improvement in hydration markers.
Excellent. Now I will come to discharge him because it's a team decision and not just a medical decision. At first, I thought Mr. Eric was ready for discharge because his stroke condition has improved, but his overall is not.
This case shows that the importance of the speaking out when we notice a difference in patient condition.
Nutrition is not a small issue because it directly affects strength and function.
And swallowing difficulty can be hidden, but it can cause serious complications if missed.
Medication safety is part of patient safety.
Laboratory finding help confirm clinical concern and also guide management.
The conflict was resolved through respectful communication, shared decision making, and patient care center.
Interprofessional teamwork improve patient safety.